start. Good morning, good afternoon, good evening. I'm Jessie Brandt, Director of Programs and Operations for the Global Wellness Summit and Institute, welcoming you to the Wellness Economy Research webinar series. Please introduce yourself in the chat and let us know where you're joining us from. Before we start, here are some quick logistics. Feel free to select speaker or gallery view, and please keep yourself muted when you're not speaking. I will mute everyone now. Our speakers, please make sure to unmute before you start. Everyone is muted. Please turn on your camera if you can. The call is being recorded and you will receive a follow-up email with the chat and recording and important information later today. The policy toolkits are roadmaps with detailed directions for bringing wellness to our communities. Think of our researchers, Tanya Callender, Catherine Johnson, and Ophelia Young, as a human GPS, helping to locate opportunities and showing us all the signposts that lead the wellness conversation towards impact. I'm happy to turn this over now to Catherine to start the conversation. Good morning, Catherine. Over to you.
Thanks, Jessie, and welcome everyone. So as Jessie mentioned, today our topic for this webinar is going to be wellness policy. And this is a topic that the research team at GWI started working on back in 2022. So for about 3 years now. And we have a lot of things to cover on this topic today. We're going to cram in a lot of different information. So we may leave a few minutes at the end for questions, but we'll just kind of see how the time goes. And when we originally planned this webinar and picked the topic, it was several months ago, back in November or December. And, as we all know, a lot has changed in the world since then and in the policy environment. So we realized as we were planning this that we kind of have to address the elephant in the room first, which is that we can't talk about wellness policy without first addressing what's been happening here in the United States with the government and the impacts that's having on health and wellness and policy issues. So we're going to start out with that, just making some observations on the current policy environment for health and wellness. We just want to add the disclaimer that this is not intended to be a political discussion. It's not intended to be any kind of official position by the Global Wellness Institute. This is the research team's webinar, and these are simply our own observations as people who have been working in the intersection of economics and public policy, and more recently wellness, for a very long time. I actually added up between the three of us, or among the three of us, Tonya, Ophelia, and I think we have like 85 years of work experience in those topics, which is nuts, especially since we're only in our 30s and we started very young, right? So these are topics that are near and dear to our hearts. They're things we've been working on for a long time. So, if you've heard us speak before, you probably know that all of us in the research team and at GWI believe very strongly that access to basic health and safety and well-being really should be a basic human right for everyone. It should not be something that's a privilege just for the wealthy or just for certain segments of the population. Now, those of you who have been following our research with GWI also know that a big focus, an increasing focus of our work has been on how to expand wellness for all. And that was the impetus behind developing this wellness policy series. Because even though we have the wellness economy where we're spending $6.3 trillion every year globally on wellness, we are still leaving behind so much of the world, and we know that we can't buy our way to wellness for all. Now, unfortunately, the policy changes that have been happening here in the United States since January, and the way that those changes have been taking place have really been moving us in the exact opposite direction. Most of the things that are happening are the antithesis of wellness. Now, all three of us have our own thoughts on how our current government policies here in the US are having a very negative impact on the health and well-being of everyone, not just in this country, but also people around the world. So I will start out, and then I will pass the mic to Tonya and Ophelia. And then once we, spend a little time on that, then we'll move into the PowerPoint slides. I just want to start out and say that, the number one most alarming development that we're seeing happening is the complete defunding and the dismantling of our entire public health infrastructure here in the United States, which has massive impacts across every aspect of health. Literally just this week and even just yesterday, we've been seeing the dismantling of the Health and Human Services Department. That's the department that really, leads the charge in the United States nationally on all public health and health topics. Underneath HHS, we also have the Food and Drug Administration, the Centers for Disease Control and Prevention, NIH, all kinds of agencies that handle these topics. All of those agencies are losing 20 to 25% of their staff, and there are many repercussions from that. This has a massive impact across every angle of health and prevention because these agencies oversee our public health policy. They oversee health services, rural hospital services, data collection on disease outbreaks, preparing for health crises and pandemics, drug approvals, drug safety, medical devices, food safety, services to the elderly, service to the disabled, minority populations, health equity, substance abuse, mental health services. I mean, you could just keep going on and on with this list about all of the things that are going to be affected. One of the plans that was also announced just in the last week is that the CDC's mission is going to be limited in focus to only look at infectious disease and no longer chronic disease, which of course is crazy because that's completely ignoring the reality that chronic disease has been our biggest public health crisis and our leading cause of death for over 80 years. Alongside that, we have so many other policies, and we don't have to go in too many details, but things that are removing access to care for many different segments of the population, effects on reproductive rights, gender affirming care. I mean, so many different groups are being affected by these changes. We also have the question and sort of the looming threats of cutting programs like SNAP, which provides food assistance to 42 million people in this country, and possible cuts to Medicaid and Medicare. Those programs provide health services to over 1/3 of the US population. And of course, these changes are not just having an impact in the United States because we are also defunding and dismantling health programs all around the world, with the US withdrawing from the WHO and also the elimination of our foreign aid under USAID. This is a massive blow to global health everywhere because the United States is the largest donor country to the WHO. We're also the largest provider of health aid and food aid around the world, working in over 160 countries. The programs that are being cut are life-saving programs in all kinds of poor countries. Things that provide vaccines, contraception, medications, healthcare, food, clean water, basic sanitation, really the essentials of health for millions and millions of people. As a result, we're seeing countries all over the world closing hospitals and clinics, shutting down clinical trials, and ending programs that prevent HIV and AIDS, TB, polio, malaria, I mean, you name it. This is, of course, going to lead to worse health, more disease, and more deaths around the world. But of course, we can't even know or track the impacts of all of this because all of these cuts mean that there's a loss of data collection efforts. So no one is really officially tracking it. There is a researcher from Boston University who's developed a tracking methodology to look at some of the outcomes. And their tracker says that there have already been 160,000 excess deaths globally just in the last 2 months from the cuts to the US foreign aid program. And that averages out to over 100 deaths per hour around the world. We're also losing our capabilities for disease tracking, surveillance, and data collection from the global level across countries all the way down to the local levels. And of course, that's going to reduce our ability to respond to health crises in the future. Even if you don't care about foreign aid, we know from the COVID pandemic that our health risks are global. Viruses do not respect borders. So, all of these global cuts to aid programs are going to affect everyone here in the United States when we can't track or respond to disease outbreaks or possible pandemics in the future. So, I'm
So,
going to pass now to Ophelia.
yeah. So, another major area of concern is that there seems to be a war on science going on, both on scientific evidence and on scientific research. So we just lost billions of public funding for scientific research. And with the massive firing and budget cuts at NIH, the National Science Foundation Center for Disease Control, there is like a major interruption of a lot of the research that may now never be completed. And these are, biomedical research, clinical trials, and basic science. And we're talking research that at the Cancer Institute on aging, Alzheimer's, drug and alcohol abuse, and on mental health. So the funding is also leading to a loss of expertise when many experienced researchers are now losing the jobs across governments, universities, and nonprofits. By some estimate, every dollar spent by the NIH on research has produced $5 in return for the society. And let's not forget that nearly all of the 350 drugs approved between 2010 and 2019 can trace the development to federal funding. So this dismantling of a health science research infrastructure will take years to rebuild, and the impact will be massive. There is also a purging of information from government websites based on ideology. So we're talking about the removal of public health data and resources on the topics of LGBTQ populations, HIV/AIDS, safe contraception, and health disparities for minorities. It is as if this data disappear, then these populations or the needs will disappear, which is really ludicrous if it's not also very harmful. And this is happening at a time when there's a loss of public trust in science and in institutions. And we've seen this in the wellness space for a long time now. There's some sort of health libertarianism that is rising. Like, we are free to choose the type of health information that we like to believe in and to follow. So many people are now just choosing to follow podcasters and TikTok influencers rather than their doctors or public health officials when it comes to health information. And of course, now a major public health agency is led by one of the most vocal vaccine skeptics, and who has worked against vaccines of all kinds, COVID, HPV, measles, etc., while pushing for questionable remedies like vitamin A or cod liver oil, or the idea that people should build their natural immunity by getting these diseases. So we're already seeing in the United States a measles outbreak, and for the first time, even a death of a child who did not have any pre-existing conditions, and of course, who had not had the measles vaccine. So these are very, very alarming developments on the policy front that could harm our health and wellness going forward. Tonya, I think you have some points to make too.
Yeah, I have a couple random thoughts. The rapid loss of tens of thousands of government jobs, as well as the cessation of funding for U.S. federal agencies, have had ripple effects, leading to job and business income losses in the private sector, both in the United States and around the world. And the financial and economic and emotional strain on a growing number of families is going to further burden our local and national social support systems. And with a trade war looming, consumer confidence in the United States and other nations is down. The Consumer Expectations Index in the United States is the lowest that it's been over the last 12 years. People are concerned that we're going to continue to see rising costs, continued job uncertainty, and maybe a recession. In the US, consumers, even the wealthier ones, are scaling back on purchases, including services. And as these trends continue, we may very well see a reduction in consumer spending on tourism and wellness services in other nations as well. Now, the US health sector, as we've been talking about, would actually be one of the sectors directly affected by US import tariffs, which we've heard a lot about lately. This sector relies on imported medications and medical supplies and could witness higher costs, resulting in either higher consumer costs or less access to healthcare products and services. And finally, I just want to make a few comments about our mental well-being. The rapid changes over the last 3 months have created uncertainty around the world's ability to manage global challenges. Everywhere, people are feeling more anxious and stressed. They're worried about their financial and job security, their health prospects, and the environment. And then there's wellness at work. The current US administration has threatened employers and organizations that do not adhere to its agenda. And it's also gone about weakening institutions that are designed to protect worker health and safety. Consider what this signals to domestic and international employers about the fair treatment of workers, including women, LGBTQ employees, and people with disabilities. If the US government does not care about worker mental health and overall well-being, will private businesses? And finally, we need to mention the harm that's caused by the US government's actions against certain groups. We've seen abrupt mass firings of government workers and large-scale deportations and incarcerations without due process. This has hurt families and destabilized communities. Programs and institutions that respect our differences, whether they're cultural or ideological, are facing strong opposition. And it's having a chilling effect. For example, fear is prompting the suppression of the history and artistic expression of women, people of color, and the LGBTQ community. All of these changes are increasing our anxiety and challenging our mental well-being. And some of us are wondering, who's going to be next to lose their job, their freedom, their family member, or even a valued employee? Okay, so we have shared some of our thoughts about the current situation. I think we've painted a very strong picture of what wellness policy is not. So now let's look at what wellness policy should be and how it can support global well-being.
So when we first developed the concept of wellness policy, we think of policy as affecting our wellness on 3 levels. And so we've had this chart up for a while, last 10 minutes or so, that you can see there, the half circle with 3 layers, levels. So the outer layer is what we call the macro level policy. And this includes all kind of broad societal and economic issues that we just mentioned on employment, on social, economic, and on healthcare sphere. These can have outsized impact on our health and well-being. And solving these issues require long-term political processes and compromises. And for example, in the US, it is related to our 4-year election cycles. But even when we cannot influence the macro policy environment, we still have other levers that we can use. So with wellness policy, we are proposing that we take actions on the meso and micro levels. And these tend to be policies that can be taken at local and state or regional level, and even outside of the government. So even when the macro environment is very unfavorable for our wellness, we still have some room to maneuver in the wellness policy sphere so that we can improve our health and well-being right away without waiting for all these bigger issues to be resolved. So this slide shows our definition of wellness policy. It is a set of cross-cutting actions that encourage healthy lifestyles and create supportive environments for our health and well-being. This is a wellness ecosystem graphic that can help us illustrate this concept. Most of us have heard this statistic repeated many times, that 80 to 90% of our health outcomes depend on our environment and our behavior and lifestyles, which means even if we are genetically predisposed to have certain diseases, it is up to us to reduce those odds. And micro-level wellness policies are those that can influence our individual behaviors. They encourage us to make healthy choices on a daily basis. And these policies can nudge our behavior toward wellness by making healthy choices more fun, more convenient and accessible, cheaper, or even our default option. For example, some regions and countries have used financial incentives to shape behavior, like putting a tax on sugar and junk food. or subsidies on healthy foods so that healthy food would be cheaper and unhealthy food more expensive. We can also encourage healthier choices with information and education, like when we put warning labels on packaged food that are high in sodium or added sugars. Now, at the meso level, wellness policies are those that create environments that support us in adopting a healthy lifestyle. And when we say environments, we are referring to the physical and community environments that we interact with every day in our homes, our neighborhoods, our cities, schools, and workplaces. For example, investing in parks and green space and make them accessible in all communities are really important, as we have come to find out during the pandemic, because they encourage outdoor exercise, social activities, and can provide mental wellness benefits in many ways. So who is wellness policy for? Well, it should be for everyone. Every single one of us can benefit from having easier access to healthy choices and environments that encourage us to live a healthy, active lifestyle. Wellness policy should specifically target our needs toward different points in our lifespans. Pregnant mothers and infants, children and teenagers, to the working population and seniors. Wellness policy should also target disadvantaged and marginalized groups, especially those that have been left behind by the wellness economy. For so many people, their basic needs are not even being met. So forget about buying wellness services and products. But those are the populations that are at the highest risk for poor health and need wellness the most. And even those who live in the worst circumstances, like even in war zones or refugee camps or in prisons, they can benefit from individual wellness practices and pathways. Wellness cannot solve all the big macro problems like the ones we talked about earlier, but it can help everyone cope and build resilience and deal with adversity. So the goal of wellness policy, like Catherine said, is wellness for all. So this is a slide. This is what we call a continuum graphic. And it is a good way to look at wellness policy and where it fits into the wider policy landscape. On one hand, we have medical policy and health policy, which really deals with curing disease to prevent disease inside a medical paradigm. On the other end, we have happiness and well-being policies. You might have heard about countries like New Zealand doing well-being budgeting or creating a minister of happiness or minister of loneliness. Wellness policy is meant to complement these efforts, but it is not the same thing. We can see wellness policy as leveraging or filling gaps in all the existing efforts in healthcare, in public health, in happiness and well-being policies across the wellness continuum. So we're not asking that every country or government set up a ministry of wellness. That kind of effort is not feasible in most places, and it may not even be the best approach. Wellness policy is not the same as health policy either. And so we're not expecting it to be sitting within the Department of Health or a public health agency. And wellness policy is also not a top-down effort. It could be formulated at every level of government, national, provincial, and city level. And we want everyone to think of wellness as a lens or a filter for all kinds of public policies and government actions. We want government leaders and policy to understand that all their decisions and investments can directly affect people's health and wellness, no matter what department they're working in. So we're talking about government officials dealing with agricultural trade agreements or doing workplace safety inspections, or city planners or local councils deciding on neighborhood parks and libraries. These public officials can have as much or more influence on our health and well-being as our doctors. So wellness policy needs to cut across all these different government silos. So who is responsible for wellness policy? Well, we're not going to sit back and just wait for governments to take action on wellness. Now we see that government at the highest levels can actually work against our wellness. But every single one of us as individuals, communities, in a nonprofit or in business can advocate for wellness policies and practices and be partners in promoting wellness at the local, regional, and community level.
So why should you care about wellness policy? Many of you may be associated with a wellness business, and businesses often don't like policy and government because government is associated with unpleasant things like taxes, regulation, and bureaucracy. But let me give you 5 reasons why your business should be engaged in wellness policy. Number 1, government invests in many things that are important and even vital to the wellness industry. For example, the infrastructure and public space for physical activity and tourism. Government invests in education and training, the workforce for hospitality and the spa sector, in complementary medicine. It also educates nutritionists, wellness architects, and public health professionals. Government also invests in basic science and in research that establishes critical clinical evidence. This empirical evidence is used by wellness entrepreneurs to develop new products, services, and therapies for consumers. So our industry really benefits from many government investments. Number 2, public policies can increase consumer confidence in the wellness industry. This is especially important when so many new products and services are coming out with wellness claims. For example, we have all kinds of supplements and diet fads, extreme workouts, VR and light therapies, and psychedelics. Unfortunately, in some areas, the claims are really stretching science and evidence. Because of this, the wellness industry is sometimes criticized by doctors and scientists, mocked in the media as well. And of course, if products are ineffective or if they harm consumers, they can end up hurting the whole industry. So in order to protect the honesty, integrity, and reputation of the wellness industry, we do need the right kind of policy and regulation. Number 3, like it or not, government sets rules for the market, and these rules can support things that are considered important to society. The pandemic made this really clear for the fitness sector, whose spaces were closed. And we ended up with having more people who could have benefited from exercise and community lumped together with bars and restaurants. Now, a wellness policy approach will treat the physical activity sector as an essential service that protects our health, not as leisure or entertainment. Number 4, policy can protect the assets in the wellness industry. Wellness consumers are drawn to things that are authentic, natural, and sustainable. We need to protect our environmental resources for outdoor recreation and wellness tourism. We want to protect the knowledge and traditions of healing, which means also their intellectual property rights, and the biological resources found in indigenous and herbal medicine. All of these assets only can be protected with policy. Finally, we have to remember that governments are also customers in the wellness market. Government buys health services, including complementary medicine, therapies, and wellness modalities. And in some countries, they even pay for visits to wellness resorts. Governments operate public exercise facilities, they buy equipment, hire fitness instructors, and they contract with private operators. Governments are also major employers in every country, and they procure things from many kinds of public institutions like public schools and universities, hospitals, military facilities, and government departments. So potentially, governments can be a large market for healthy eating, wellness architecture and design, workplace wellness innovations, and other wellness sectors. So with these 5 reasons, hopefully you no longer have a negative view of government. And you might be considering how wellness policies can help your business and your sector. And perhaps you're pondering how to actively support wellness policy.
Okay, so when we talk about public policy and when you talk to governments, a big topic that always comes up, or a big question, is always, what is the potential impact of these policies? What is the return on investment that we can expect when we are taking our scarce public and private resources and investing them in health and wellness? One of the big probably the main reason for all of the cuts to health programs and funding here in the United States, which we talked about at the beginning, has been the idea that supposedly the government is saving money or balancing the budget. Um, this kind of thinking can be very short-sighted, or you could use the phrase, penny wise, pound foolish. And that's because our health and our well-being, not just in this country, but all around the world, has been in crisis for a long time. From aging populations, chronic disease, rising healthcare costs, poverty, hunger, extreme weather, climate change, environmental risks. I mean, you can just go on and on. All of these crises are costing us trillions of dollars when we do not address them. So we put some numbers on this slide, and if we were just to add up these estimates, we're spending over $10 trillion annually globally on our health expenditures, and then we're losing another $23 trillion every year from our inability to solve all of these health crises. And these numbers just keep going up. That is a massive, massive number when you compare it to, global GDP. So what's the upside? If we do invest in programs and policies to support and improve our health and well-being. Now, I have to give the caveat that it is incredibly difficult to calculate an ROI for wellness, because whether we would look at individuals or look at communities or even larger population groups, the benefits of wellness activities and healthy lifestyles are things that manifest over a very, very long time horizon, over our entire lifespans. And of course, there are so many confounding factors at work, things like our genetic, our socioeconomic conditions, environmental exposures. All of these things affect our outcomes from health and wellness activities, and they affect the ROI when we would try to measure the impacts of wellness policies and interventions. So this is not the type of research that, the GWI research team normally does ourselves. But a couple of years ago, we did do a quick review of different ROI studies that have been conducted by the WHO and other academic researchers. And if we put a sample on the screen here, these studies indicate that when we invest in things like public health and invest in managing chronic disease and do other health promotion efforts, there is an ROI of between $4 to $14 for every dollar invested. And that's a very, very strong outcome. So we can see that the potential economic return from investing in wellness is enormous. And of course, that's just the economic calculation of it, the dollar signs. And we cannot forget the even more important human impacts when we have people living healthier lives and happier lives. So this is just one other way of thinking about the positive impacts of wellness policy. And let me explain these charts. A couple of years ago, and some of you may remember this because we've presented on it before, but a couple of years ago, we had the opportunity to collaborate with one of the main statisticians from the UN World Happiness Report. And we worked with him to look at whether spending on wellness is related to happiness or health. So he conducted some regression analyses for us. And here you see just a couple of the charts that show some of our key findings. And to interpret these, what we found is that wellness spending, or the wellness economy, is positively correlated with both happiness and life expectancy and other health outcomes. So in this analysis, we did control for some factors like population size and GDP per capita, to control for country wealth levels. And the result was we found that across countries, every increase of $844 in wellness spending per capita is associated with a 7% increase in the average happiness level in that country. And then looking at health indicators, an increase in $769 in wellness spending per capita is associated with nearly 1.3 years of additional life expectancy. We also found, they're not on the charts here, but we also found positive correlations between wellness spending and health outcomes like infant mortality, child mortality, and the risk of premature death from chronic disease. If you know your statistics, all of these results are statistically significant at the 1% level, which means the findings are not due to chance and the correlations we're seeing are very strong. Now, if you don't remember taking college stats, we do have to emphasize a caveat on these numbers that these are correlation analyses. Correlation is not the same thing as causation. So you can't take these data and say that spending more money on wellness causes happiness levels to rise or that causes life expectancies to rise. What we can say is that there is a close and positive relationship between wellness economy, happiness, and life expectancies. So, with all of that, I hope we've made a convincing case for why we need to be thinking about wellness policy and why we all need to care about it and invest in it. So, for the last portion of our presentation, we want to turn back to some more specifics on our wellness policy reports and what's in them and how you can use them, because we have been talking at a very high level. And I think it's helpful for people to understand what this is when we get into more of the nitty gritty under different topics about, what can you do in different areas. So the report series that we've been working on, we have two initial reports. The first one was released in November 2022, and then we had the statistical analysis report. And then since then, we've been developing a series of what we call wellness policy toolkits. There are 7 of them, and each one of them is focusing on a different specific topic or domain within wellness policy. And you can see the topics listed there. Now, what these toolkits do is that they outline first, why do we need wellness policy in that area? They make the case. And then we give a lot of specific recommendations and possible action steps that how we can use to sort of take action to improve our wellness in this area. And these are actions that can be taken at any level of government or by nonprofits or even in the private sector. So far, we have released 3 toolkits on the topics of physical activity, mental wellness, and wellness and tourism. And so now we'd like to spend a few minutes going through each one of those 3 and just tell you a little bit about what is in each one. And we'll start with wellness and tourism.
So we call this toolkit Wellness and Tourism. And I would imagine, a number of you on this webinar or people who registered are in the hospitality sector or in the wellness tourism sector. And as you know, wellness tourism is really an enduring trend and one of the fastest growing tourism segments and wellness industry segment. But whenever we hear tourism and policy being put together, I think we automatically think of tourism promotion efforts by government. But this toolkit is want to advance a broader and deeper concept than that. The objective here is to unite the concept of wellness with tourism so that tourism and wellness are mutually reinforcing. And when it's done right, wellness tourism can improve the quality of the visitor's experience, as well as the quality of life for local residents and the destination. So this toolkit focuses on a few action areas. One of them is to promote a broader understanding of wellness tourism and its impacts among all stakeholders. And a lot of you might already know that wellness tourism is high yield tourism. The international wellness tourists spend 36% more than average international tourists, while domestic wellness tourists spend 163% more than the average domestic tourist. So wellness tourism is an attractive tourism niche for the community because it can help to bring in more tourism dollars and also diversify the market, improve seasonal fluctuations, and bring investments and economic benefits to less developed areas. Another action area is to bring together the wellness tourism economy with the local economy. Sometimes we may see wellness tourism offerings as kind of narrow if we limit it to yoga retreats and spas and activities that we can offer inside a resort. But when a visitor leaves the resort, they are just as interested in all those things that are central to the wellness of a community, like local food, music, and art scene, walking trails, nature areas, public parks, walkable areas, and public plazas. The High Line in New York and all the projects that it has inspired around the world are good examples of this kind of investment. So wellness tourism can offer a very powerful value proposition to invest in the local wellness infrastructure and quality of life and integrate this infrastructure with the wellness tourism economy. We have an action area on workforce because the people who work on our wellness when we're on vacation and in the hospitality space are often themselves not well. So we need to have policies that protect workers from harm and also support their well-being. We have an action focused on sustainability. And we know a lot of popular destinations are now suffering from their own success, degraded by poorly managed tourism, which can cause overcrowding, housing problems for local people, and environmental issues. And because nature and authentic local culture, a very important setting for wellness tourism, it can provide extra incentives for governments and communities to protect these assets. We also have to recognize that wellness sectors evolve very rapidly, and it is challenging for governments and policies to keep up sometimes. And these could range from policies on whether to legalize psychedelics and to how to regulate water and safety in mineral and thermal springs. So one policy action area is to really follow what is global best practices and follow scientific evidence and develop appropriate regulations on all of these different sectors and modalities. And also it's really important to provide visitors with up-to-date information. So these are just some examples of what is covered in the Wellness and Tourism Policy Toolkit. If you're interested in more, please check it out.
So just going to talk briefly about the Mental Wellness Toolkit. Even before the significant policy changes in the United States, we've been witnessing a host of threats to our mental well-being: political conflicts, environmental crises, rising stress, and loneliness. And today, about 1 billion people are struggling with a mental health issue, and we only have about 13 mental health professionals per 100,000 people. And the cost of global anxiety and depression is estimated at $1 trillion a year. And we firmly believe that mental wellness policies can help to address our mental health crisis. And that's because mental wellness is a resource that both protects and promotes our mental health and well-being. It builds resiliency, and which is what allows us to cope with life's challenges. Now, given the high degree of stress and depression and loneliness in our communities, we would think that individually and collectively, we are actively supporting our mental wellness. But unfortunately, not enough people understand that mental wellness is a key tool for promoting and treating mental health. Also, many lack opportunities to build this resource. The Mental Wellness Toolkit aims to address these challenges using a community-focused approach to supporting mental health and well-being. After describing different pathways to increasing our mental wellness, it provides guidelines and resources to help individuals and also communities strengthen their resilience. So you can see we have 5 policy solutions, and they're designed to help increase knowledge and opportunities. To increase awareness, we recommend policies that raise mental wellness literacy. This means not just letting people know what mental wellness is, but also providing education and training so people can develop skills and practice mental wellness techniques. We also want to increase wellness opportunities for everyone. And for some communities, that might mean creating spaces like parks that help strengthen our mental wellness. For others, it may mean improving transportation to link more people to existing mental wellness opportunities. Now, the Mental Wellness Toolkit also describes ways to use existing community resources and a variety of partnerships to bring wellness into all of our neighborhoods. So thinking about rising loneliness, we know that loneliness, particularly for older adults and youth, is a growing problem. Last year, 1 out of 5 people in a global Gallup survey said they felt lonely a lot of the time. Having social supports and a sense of community are crucial for mental wellness, and this toolkit provides recommendations to help people improve their social connections. Globally, our youngest generations are struggling. The WHO estimates that 1 in 7 10 to 19-year-olds are trying to manage a mental health disorder. In many countries, younger generations are reporting higher rates of anxiety, sadness, and feelings of loneliness. They're worried about lack of opportunities, conflicts, and climate change. With the rise of social media, our youth face significant and alarming challenges to their self-esteem. To protect youth well-being, Australia, France, and certain states in America have implemented social media bans or restrictions for younger teens. The Mental Wellness Toolkit takes a holistic approach. It discusses the need for policies that minimize the dangers of technology, but it also describes policies that develop youth social skills, increase their support systems, and help them to explore their own mental wellness pathways. And our last policy recommendation calls for concerted action across wellness domains that can also support our mental wellness. For example, physical activity, and also the built environment are very important for supporting our mental health.
Okay, so I will just give you a quick description of the third toolkit that we've released, which is the physical activity toolkit. That was actually the first one to come out, I think 2 years ago now. So we all know that physical activity and physical inactivity is a major contributor to our health outcomes, and it's a major contributor to preventable disease. The latest estimates show that over 27% of adults around the world are physically inactive based on WHO definitions. And physical inactivity is now the 4th leading cause of death globally. So one of the big focuses in this toolkit is, how can we increase access to the environments and places and spaces and infrastructure that will make it easier for all of us to engage in physical activity? Because one of the biggest barriers for everyone is time and convenience. How can we do this and fit it into our busy lifestyles and our schedules? So the first part of the toolkit really emphasizes the design of our built environments, so our cities, our neighborhoods, our buildings, and how can we create environments that will encourage us to move in our daily life, what we call active transit, walking and biking as transit. And we can incorporate those types of movements into just our daily activities. It makes it much easier for us to get the exercise we need. Another aspect of this is building more facilities and programs for recreational physical activities, which are the things we would do in our leisure time. How can we make those more convenient, cheaper, or even free for everyone to access? That way, again, we can more easily and with fewer barriers get the exercise we need and in a way we enjoy doing it during our leisure hours. So this would be access to facilities that let us do walking and running for fun, outdoor exercise, outdoor dancing, or martial arts, or different types of sports or outdoor recreation. All of those are ways that we can get physical activity. The other big focus of this toolkit is on how can we bring more physical activity opportunities to all types of underserved and disadvantaged populations. That includes women and girls, youth, minority populations, people with disabilities, people with chronic disease, and many other marginalized groups. It's important to bring more access to all of these because these segments of the population are typically either the most inactive or at the highest risk for chronic disease. And so, several of the focuses in the toolkit provide tangible, recommendations on how we can bring access and reach those groups. So I'm not going to spend more time on this toolkit, but I think as Ophelia mentioned, we really encourage you, if you're interested in these topics, to go to our website, download these and take a look. Each one of these toolkits is 80, 90 pages long. They're packed with information. And I did also, before I wrap up, I did notice there was a comment in the chat wondering if these policy toolkits are for the US or global. I do want to emphasize that this entire series, all of the toolkits, and actually all of the research we do at GWI is globally focused. That's a core part of our mission. And so what we've done in this series and in the toolkits is on each of these topics, we do try to provide some tangible examples from different countries all around the world, showing how different places are trying to implement these types of policies or to, find success in these areas. So yes, these are globally oriented. So I'm going to go forward. So, I would encourage you to keep an eye out because we will be releasing more of these policy toolkits in the future. It takes us a long time to write these, and so we are rolling them out very slowly. But we anticipate that the next release will probably be the Wellness at Work toolkit, possibly later this year. We'll see. And after that, I think the next one may be the toolkit for the built environment. So again, please download these and use them and share them with people, who aren't on this webinar who might be interested in them. So just to wrap up, and then I guess we have a couple minutes for questions, but we did start out this webinar with a lot of negatives. There are a lot of negative things happening in the world right now. But we hope that this conversation about wellness policy has helped us to really start thinking in a positive direction about how all of us can be advocates and can be champions for better health and well-being. And our goal with the wellness policy research and the report series is to try to spark a new global conversation and a movement for wellness policy and for wellness for all. And as we've said, this is a movement that can be championed by governments, but also by businesses and nonprofits and communities and individuals and all of us. So I will wrap up. And I guess, Jesse, if you want to field any questions, you can take over.
Yeah, I'm just checking. Jane is asking, have you offered guidance on how we can address the challenge of viral misinformation on health issues? Does anyone want to answer that?
I think that's a topic we have not, it's a very important topic. It's not a topic that we've covered, I don't think, yet in these toolkits, but I think the one that is going to focus on traditional and complementary medicine, that's a topic area under there. Ophelia, if you want to correct me if I'm wrong.
Yeah, this is, I mean, this has been a problem, and the misinformation, and also at the same time, unfortunately, it's like a boon for a business that want to promote products and services with very little evidence. And the most important response is actually investment in research and disseminating the research on these evidence. So, and then this research also cannot be just sponsored by business interests because, of course, they want to promote and certain, modalities of products. So really, we need like disinterested, objective research parties to do that kind of research and disseminate. But it is really like a big long-term problem that it's not going to be easily solved. And I can't tell you that it is going the right direction in like the US right now. Maybe in the rest of the world, you can invest more in this kind of research.
Yeah, and actually, I think one other sort of initiative we've seen going on in that area that's outside of just basic research and government is there have been some academic institutions and public health schools and doctors who have been trying to mobilize a different presence on social media. Social media and the wellness space is very much dominated by influencers who are self-made experts or have just built a following and may or may not be true experts on what they're talking about. So there are people already doing this, but opportunities for true public health experts, biomedical researchers, doctors who are doing these studies to have more of an influencer type presence in these same spaces and provide fact-based and science-based information.
Thank you. We have a couple more questions in the chat. Let's see. What are your perspectives on connecting health and wellness coaches in the private sector?
I don't know. That's a policy question. I don't, I mean, is it like business strategy advice? I don't really, I don't think we have an answer to that.
We also, I can refer to the health and wellness coach. What are they calling them now? We had an initiative until shortly, and they opened up we stopped the initiative and they opened up their own association. So I think it's the Health and Wellness Coach Association. I can share the link in the follow-up email to them. So if you're not familiar with them, Alan Kocher and Jocelyn Pep, they are a great resource. And then we have another question. Thank you. When you get to the topic of employer toolkit, check out the Edelman-Schoss. Okay, that's no question. Anything? Where do I find the happiness and wellness analysis paper? All our research reports are up on the website. If you look under research, and all are free to download. So if you just look a little, you will find the happiness and wellness.
Yeah, actually, we have a landing page for the wellness policy series, which is all the report covers you see up on the slide still, and the URL is right at the bottom.
Yeah, and
so
I shared it.
Go there.
I will share that again in the chat.
Yeah, so that has all the statistical analysis, the other toolkits we've talked about, and the new ones when they get released will be there as well.
Yes. Wonderful. We have 1 minute left. Thank you so much for joining us. Thank you, Tonya, Ophelia, and Catherine, for all you do. And if you all want to unmute and give our researchers a hand, that would be fantastic. Thank you for joining us. You will all receive a follow-up email with the chat, the presentation, the recording, and important links that we also want to provide. So thank you, everyone, and have a great rest of your day.
Yeah. Thank you.
Thank
Thank you.
Thank you.
Have a good day.
Thank you.